For the last few slides in this chapter, I'm going to just talk some more about the different kinds of medications. So here's just some random facts about some of the antiretrovirals that the author wanted you to know. We said that protease inhibitors prevent that enzyme from allowing proteins to be developed that can allow that the virus to infect other cells. Generally, what is administered is something called CART, or combination antiretroviral therapy, more than one drug. And these can be the individual drug categories given separately, or if you look at the bottom of page 101, you see that there are a number of combination drugs that can be given, including one called Atripla, which is known as a triple cocktail, and means only one drug has to be taken. Fusion in particular and some of the other HIV drugs can cause neuropathy in the fingers and toes. This is considered to be a normal side effect, and the med should be continued. The drug Reataz or Atanazavir can affect the circulatory system, so patients are told to take their pulse daily, and the doctor will give them parameters on when they should hold the drug and give it later. Raltegravir or Icentris can increase blood glucose levels, so it might make kind of a pseudo-diabetes in patients who take it. Generally speaking, side and adverse effects are pretty common, and patients are told to continue these drugs in most cases. However, if a patient is taking Sustiva and they end up with any signs and symptoms of infection like sore throat or rashes, that can indicate a serious adverse effect. With the rash, probably Stevens-Johnson syndrome, and in that case, they need to hold the med and call the healthcare provider. But most of the time, people are told to go ahead and continue taking the med. What all these drugs do is slow the advance of AIDS, try to keep the immune system that the patient has functioning properly, prevent HIV in infants born to mothers who are infected with HIV, and also prevent the acquisition of HIV infection in healthcare workers who are exposed to it, either through needle stick, which is pretty difficult to transmit that way, but it has been done, and then a body fluid splash. All of these conditions, these medications can prevent or slow the advance of HIV. Now, when it comes to drug interactions, they're very drug specific, and of course a person with HIV infection needs to form a relationship with an infectious disease specialist and have regular visits, and that healthcare provider will oversee the person's medications and kind of keep up on that. And so there'd have to be specific drug interaction teaching given depending on what the patient is taking. It is very, very essential, important to tell our patients that medications of these types do not cure HIV. The person might feel better, they might have a CD4 count within normal limits and a non-detectable viral load, but they still are not free from HIV, and it will return to do damage to their immune system if they stop taking the meds. So they have to adhere to their drug regimen. All drugs and supplements used, even over-the-counter and alternative meds, have to be reported to the healthcare provider. Many of these meds can cause pancreatitis or neuropathy, and so it's important that our patients are educated about the signs and symptoms of pancreatitis and, the numbness and tingling of neuropathy. Earlier I mentioned a protease inhibitor called Indinavir or Crixivan, and taking Crixivan can lead to what is known as Crick's belly. The person puts on a lot of fat in their trunk and their extremities kind of waste away, they lose muscle. So it's very similar to what you see with somebody who's having chronic steroid use, the truncal obesity and the wasted extremities. They're also going to experience elevated cholesterol and triglycerides, and high blood glucose. So if that's the case, then sometimes another protease inhibitor has to be taken. Patient teaching is found on page 103, as well as nursing implications for all these drugs, which is found in the tables on pages 100 and 101. Make sure you read those and remember those if you have to answer those in a question. Pre-exposure prophylaxis is fairly new. There's a drug that's discussed on page 103 that can be taken by the partners, the uninfected partners of people who are HIV positive who are on combination antiretroviral therapy, but they're only taken by people who are HIV negative. So they also have to be tested and have to have their treatment supervised. This drug is known as Truvada, and it's new enough that you can still see TV commercials about it. Now, due to the effects on the liver, antiretrovirals, like I said, they are powerful drugs. They're not taken lightly. And they can do some damage to the liver because of the liver's role in metabolizing medications. So antiretroviral drugs should be taken separately from other medications. Because HIV now is considered to be a chronic illness rather than one that's going to definitely kill you quickly. HIV patients are aging just like the rest of the population, and they're having to take blood pressure meds, diabetes meds, and all of these have an effect on the liver. So antiretrovirals should be taken separately from any other medications. So many times, they'll have you take your antiretrovirals in the morning, and then you'll take your other medications later on in the day. The last thing I want to talk about is the need for education and social and financial support for our HIV patients. It's very important that routes of disease transmission are taught because people don't always take it seriously. Although the traces of the virus can be found in any body fluid, so far the disease has only been shown to be transmitted through the 4 body fluids that we talked about: blood, breast milk, vaginal secretions, and semen. So any activities that exchange any of these body fluids can result in the transmission of HIV, and it's important that people know that. Many HIV patients need a lot of social and financial support. Some are estranged from their families and may not have that safety net behind them. They might not be able to work and afford health insurance, and these meds can be expensive. So thankfully there are government programs that set people up with both social and financial support and help them get their meds. The last thing I want to talk about is the statistics about pregnancy and HIV prior to meds and how they are now, and things have just undergone what I consider almost a miraculous change. Prior to the regimen, both medical and drug, that is given to pregnant women now, the risk was 15 to 30% that you would transmit HIV to your fetus during a vaginal delivery. And then if you breastfed, another 5 to 20% chance of transmission. So you had as high as 20 to 50% chance that your fetus would become infected with HIV, which of course at that time was a death sentence. Now the protocol is for a pregnant woman to take meds throughout her pregnancy, and generally she'll be given NRTIs, NNRTIs, and protease inhibitors. And the pregnant mom must take the drug directly as ordered throughout the pregnancy. No fooling around. Have a C-section delivery, so there's no vaginal secretion exposure during labor, and then no breastfeeding. The baby should drink formula or milk from a milk bank if the parents can afford it. It's pretty steep. But with C-section delivery, meds throughout pregnancy, and no breastfeeding, the chance of a fetus getting exposed to HIV is now less than 2%, which is just fantastic. There are a couple of links that I left talking about pregnancy and HIV meds and that makes for interesting reading in all your copious free time. So we're going to go ahead and stop here. I'm going to include the links to 4 videos that I show during my lecture, and I would really strongly advise you to watch those because they really put the information together in a really interesting way. So watch all 4 of those videos. They're all short, 3-4 minutes apiece. And we will go ahead and stop this lecture here.